Dear students, we would like to cover in this module the psychological issues that elderly experience in our society. The major learning objectives of this module is the psychological issues that the elderly confronts in our society, the importance that is required to emphasize on the mental health status of elderly, the various barriers and the psychological issues that the elderly experience, and to understand the ways in which the elderly can overcome these psychological issues so that their quality of life can be enhanced. Given this, among various issues that the elderly experiences in our society, mental health issues are very important for us to address, because compared to physical health, mental health is highly invisible, and the caregivers and the way in which the mental health issues have to be addressed are yet to be significantly to place in our society. In that regard, the efforts are required to identify the various mental health problems that the elderly experience, and we need to address on a priority basis to address these issues. Coming back to the mental health aspects, it plays a very vital role among elderly people, obviously because many old people lose their equilibrium due to their age and promotion of mental health well-being, and it is as important to these people that they experience mental health problems as to people who are mentally well. Mental health promotion thus requires adequate actionable points which, if we implement on a priority basis, that will provide enough opportunities to see that their health status, especially mental health status, will improve. We will discuss on various mental health problems of elderly in this module. What are the major mental health problems that our elderly people experience? One is, as we discussed earlier, dementia and Alzheimer's, followed by issues related to anxiety disorders, for example, generalized anxiety disorders, panic attacks, post-traumatic stress disorders, and agoraphobia, mood or affective disorders, example, major depression and bipolar disorders, substance use disorders like abuse of alcohol or minor tranquilizers, stress, psychotic illnesses such as schizophrenia, delusional disorders, paranoia, adjustments, sleep disorders. As we seen, the dementia is increasingly experienced by our elderly population, followed by Alzheimer's disease, which is very important for us to handle and also to see that our elderly issues in this regard can be minimized. The other characteristic of mental health issues is depression. Depression is common in old age. According to the Institute of Health Metrics and Evaluation 2010 data, the disability adjusted life years for depression over 60 years is 9.17 million years, or 1.6% of total disability adjusted life years in this age group. Symptoms of older adults' depression differ only in part from early life depression. They may, however, have more somatic presentations. Types of depressive disorders seen in older people are of different forms. It could be organic mood or affective disorder, bipolar disorder, schizoaffective disorders with predominantly depressive symptoms, major depressive episodes, minor depressions, dysthymia, double depression, recurrent depressive disorder, mixed anxiety or depressive disorders, adjustment disorders, subsyndromal depressive spectrum, dementia with a depressive mood. These are all different forms which can be considered. Life events that may attribute to depression, we need to understand. It could be due to bereavement of the family members, or due to separation, or acute physical illnesses, medical illness or threat to the life of a beloved person, sudden homelessness or loss of residence, major financial crisis, negative revelation regarding a family member or friend, loss of valuable or meaningful objectives. Important that we need to know is that these issues that occurs in any life event can be individually or collectively, may have a tremendous pressure in the minds of the elderly, which will lead to depression. That is why care has to be taken to see that there is going to be all these things in mind, so that when we make effort in attempting through proper interventions, there will be some effective solutions so that the elderly can be free from these things. What are the psychological treatments for depression in older patients? It could be supportive psychotherapy. Supportive psychotherapy may be provided within the setting of primary care consultations. The supportive psychological approach combines listening, counseling, and practical support, all within a general framework of empathy or solidarity without identification. The other aspect is interpersonal psychotherapy. Interpersonal psychotherapy is a manual-based psychotherapy. Its therapeutic focus is limited to current interpersonal relationships in 4 broad areas, namely abnormal grief, role transition, role dispute, and interpersonal deficits. The other aspect which we need to understand is about problem-solving therapy. Problem-solving therapy is a brief structured psychotherapy in which the patient is supported by the therapist in learning about and applying a structured approach to address problems that are causing symptoms. Briefly, problem-solving therapy consists of 7 consecutive stages like problem definition, goal definition, generating alternative solutions, decision-making stage, evaluating and choosing solutions, solutions implementation, and evaluating the outcomes, which are applied to at least one problem per treatment sessions. Family therapy. Family-based approaches may be offered both in primary care settings and following referral to a specialist. The clinician will first try to estimate the level of commitment of those closest to the patient in terms of their presence, attitudes towards illnesses, and implications for their relationships. What about cognitive behavioral therapy? Cognitive psychotherapy has been extensively used and evaluated in the treatment of depressive disorders in older people with depressive disorders. The therapeutic framework emphasizes changing dysfunctional thoughts, maladaptive values, attitudes, and thinking patterns rather than attempting to alter depressed mood directly. Depressive disorders have an adverse impact on quality of life. In addition, older people demonstrated that depressive disorders are associated with a significantly increased use of health and social service resources, as mentioned by Livington et al. The studies reveal that minor and major depressions in older people, they share similar risk factors and carry similar disease burden, including poor health and social outcomes, functional impairment, and higher health utilization and treatment costs. The medical outcome study conducted by Wells et al. In 1989 revealed that consequences of depressive disorders with respect to poor functioning, they were capable to worse than 8 major chronic medical conditions, including coronary artery disease and diabetes. Failure to benefit from rehabilitation and to reach the expected level of functioning following catastrophic illnesses was strongly associated with persisting depressions, as reported by Harris et al. In 1988. The other aspect which we need to discuss as part of mental health of elderly is the substance use disorders. The issue of substance abuse among older adults is becoming a growing concern. Though substance abuse problems are thought of as young people's problems, they should not be neglected in older adults. Substance abuse problems among the elderly are often overlooked or misdiagnosed. Consequences of substance use on physical and mental health, treatment approaches and outcomes, diagnosis and training needs, and the costs associated with substance abuse related to treatment for elderly. Substance abuse in the elderly is one of the fastest growing health problems, and it is a silent epidemic in our society. The major problems which are required in this regard is they are underestimated, they are under-identified, they are underdiagnosed and undertreated. That is why when we talk about abuse and misuse, abuse is deliberate and intentional, whereas misuse is inadvertent, at times perpetuated by the healthcare provider. What are the problems of substance abusers? Cognitive impairment happens, tremors or seizures, irritability, mood changes, agitation, sleep disturbance, unexplained pain, somatization, poor hygiene, neglect. These are some of the problems which the substance abusers, they will be noticing from them. The other issue in the case of mental health is to understand the anxiety disorders among elderly. Among older people, many worry about their health, family, financial situation and mortality. These worries are even more likely to arise when they feel that their physical and mental capacities are diminishing and that they are losing their autonomy. This is considered as a normal anxiety. However, sometimes anxiety is so intense that it causes a significant impairment in the person's daily functioning, and it becomes an important source of distress also. This kind of anxiety is not normal and is called an anxiety disorder. What are the medical conditions associated with anxiety? It starts with, say, cardiac, coronary artery disease, angina, arrhythmias, non-specific chest pain. In the area of respiratory, COPD, vestibular disorders or vertigo, neurological conditions, Parkinson's disease or on of phenomenon with anxiety, pain syndromes, gastrointestinal symptoms, endocrines like diabetes, thyroid dysfunctions. These are certain things as a part of anxiety that the elderly experience, which we need to minimize it. And especially given the fast moving nature of issues that the young population experience, especially in the major cities, it is very difficult for elderly people to cope up with life situations, and in the process these are some of the psychological issues that comes out as their way of life. The other aspect is about schizophrenia. The term schizophrenia was introduced into the medical language at the beginning of this century by the Swiss psychiatrist Bleuler. It refers to a major mental disorder or group of disorders whose causes are still largely unknown and which involves a complex set of disturbances of thinking, perception, affect and social behavior. The estimate on this incidence of people who are experiencing schizophrenia, the data shows that the number of persons over the age of 55 years with schizophrenia is expected to double over the next 20 years from 5 lakhs to 1 million. In this regard, older adults with schizophrenia rate health as their top priority, as that have poorer physical health than peers of the same age without schizophrenia. Schizophrenia has disruptive effects on many aspects of life that may affect older adults. Older adults with schizophrenia have increased mortality that may be due to a variety of factors such as patient characteristics, attitudes of healthcare providers, and institutional factors. Over 90% of people with untreated schizophrenia are located in developing countries like India. What are the signs of stress? Although there are tremendous differences among individuals, if you are feeling stress, you may have one or more of the following symptoms: worries, anxiety, panic attacks, sadness or depression, feeling pressured and hurried, irritability and moodiness, difficulty concentrating and making decisions, physical symptoms such as stomach problems, headaches or chest pain, allergic reactions such as skin rash or asthma problems related to sleeping, feeling overwhelmed and helplessness, drinking too much alcohol, smoking or misusing drugs, the sexual dysfunctions, eating too much or not enough. So these are all things which are important for us to intervene. What are the potential sources of chronic stress in the elderly? Declining health and mobility, dependence on other caregivers, sensory loss, cognitive decline, housing problems, major problems affecting a family member, marital difficulties, socioeconomic decline, problems at work or retirement, caring for a chronically ill and dependent family member. In this regard, given the complexity of issues that the elderly experience in our society, the sources that contributes for chronic stress is also are multi-dimensional, and they are individually or collectively influences in the elderly of having a mental health problem, especially the chronic diseases. Importance of mental health of elderly. Older adults face special health challenges. Many of very old lose their ability to live independently because of limited mobility, frailty, or other physical or mental health problems, and that's why they require some form of long-term care. Mental health is a crucial component of overall health and well-being. It's important to all of us, no matter what our age. Mental health is important. It is a positive ability to enjoy life and cope with its difficulties, as brought out by World Health Organization. It is a resource that enables us to grow and learn and experience life as enjoyable and fulfilling. Mental health promotion among older people can be many ways. To begin with, it can be through strengthening individuals by increasing emotional resilience through interventions designed to promote self-esteem, life and coping skills such as communicating, negotiating, and relationship skills. The other aspect is strengthening communities by increasing social inclusion and participation, improving neighborhood environments, developing a range of interventions which support mental health for people of all ages, including anti-bullying strategies at school, programs to improve health in the workplace, community safe measures, and self-help groups. The other dimension we need to understand is about how to reduce structural barriers to mental health by tackling societal structures through initiatives to reduce discrimination and inequalities and to promote access to education, meaningful employment, housing, services and support for those who are vulnerable. There are several common barriers of psychological issues that the elderly faces as part of their day-to-day life. When, especially in urban setups, it is common that they will have barriers like transportation issues, homebound older adults staying with household issues but not with formal support, shrinking support systems for elderly, lack of expertise in that field, financial aspects, age-related economic issues, physical barriers to care, gaps in services for them, inadequate financing, fragmentation of various services is another major landmark of understanding how best the psychological issues are addressed. In this regard, we need to emphasize that when we talk about stratification of the elderly with respect to the living conditions, it is to be understand that the psychological issues that the elderly confronts in a particular locality or in a particular setup of rural or urban are completely distinct and different. We have to understand that the profile of the elderly and the the geographical location in which they are living and what type of support systems are available to them, the type of infrastructure that exists for them, and the type of network that is there for them to interact with not only with the family members but also with the neighborhood and in the community at large. They all make a lot of difference in understanding the psychological issues which have a direct or indirect bearing on the quality of life of the elderly people. The psychological issues, unless they are diagnosed early and also treated, it becomes a huge problem later. That is why more and more elderly experiences mental health issues, and furthermore, when we talk about gender, it has an impact because it is gender specific, especially when women we take into consideration their involvement in the social support network and also their quality of life are the major concerns. So in this process, we need to understand that when we talk about the type of interventions that are required to address the mental health problems of the elderly, we need to know the setting of the elderly in the communities, whether they are located in rural or urban or tribal, or whether we are addressing the female elderly or male elderly, or whether we are talking with respect to class group like poor, middle income and well-to-do, or when we are talking about the education background or occupational structure that exists for them, or in any living arrangements for them, all makes a difference in terms of understanding what are the common barriers that psychological issues brings out and also contribute for them not able to enhance their quality of life. The other aspect which we need to understand is that the cadre in the mental health field who can address the various issues of elderly is another important challenge for us, because there are limited caregivers and the type of expertise that is required, and also the regular training, and also to keep and maintain a pool of experts in the mental health field are also very few in number, and there is not much interest to serve elderly people given the lot of other avenues and choices that exist for these professional caregivers. In that context, we should not leave it to only the professionals. It is required very much that the family members, the community members, or the larger networks in the area of when we talk about mental health aspect, we have to bring all of them to see that each of these interventions are effective and addresses in a right way at a right time. That is why a key strategy to address stigma and promote prevention and early intervention is the ongoing dissemination of mental health information to carers, families, and the general public. If the public's mental health literacy is not improved, this may hinder public acceptance of elderly who are with mental illnesses. Also, many elders with common mental disorders may be denied effective self-help and may not receive appropriate support from others in the community. At the conclusion, what are the things which we need to understand when we are talking about the psychological issues of the elderly? One thing which we need to understand is that there are complex issues which reflects on mental health problems of the elderly. The other aspect is that mental health problems are increasing day by day, and also when we stratify the elderly population, we can see that given the feminization of aging, more and more elderly females are in the society, and the characteristics of these women being having a very, very low socioeconomic status, they invariably are experiencing low aspects in quality of life and low mental health positive status in their maintaining mental health. So these all have very big challenges for the policymakers and program managers. That is why when we talk about the mental health and psychological issues that the elderly face is that we are not able to have a professional support systems through caregivers, and also there is a huge challenge not only to educate and provide alternatives for the caregivers, but at the same time these elderly themselves have to see how best they can come out of these mental health issues so that they can also be part of the mainstream, and thereby their quality of life can be maintained. So when we address this, it should not be treated only as a psychological health workers issues, but it should be by overall developmental issues also. As long as elderly are not able to lead very quality of life in understanding that this society belongs to them and they are part of this mainstream of the economy, unless that is clearly mentioned and involved them in the outlines, it's going to be very, very difficult, because day by day the mental health issues are dominating, and when urbanization is increasing, mental health is bound to increase, and furthermore, especially like in the elderly who are highly marginalized and vulnerable, mental health is going to be a huge problem. That is why whether we are talking about rural or tribal or adults or rural people or adults or urban setups, we need to know that the mental health issues needs to be addressed on a priority basis, and thereby we can improve their quality of life.